chat. We'll start with that. And actually, Ashley and I just gonna go together. Let's spotlight Ashley as well.
Okay.
So, instead of me talking about pretty obvious, the new vaccine, which was approved on Tuesday and going to be supposedly should hit pharmacists today, we figured we better just talk about all that. I will walk you quickly through the CDC recommendation, which basically goes like this. Anybody who have had a vaccine more than 6 months ago should be getting this one. They recommending if you had a COVID or another vaccine, you wait at least 2 months. So this is a little bit in disagreement with how I was giving you suggestions before, meaning I actually prefer a longer period. I think at least 6 months is the reasonable statement. I still recommend waiting 12 months before the boosters. And CDC says it's okay to give all the boosters together, meaning to give everything, RSV, flu, and the COVID all together, which you, of course, know I'm opposing adamantly, that you separate all the vaccines at least by 4 weeks. So that's just a real brief summary. I think let's start with questions. I know Ashley has a few things prepared as well, but we sort of just decided that we're going to concentrate on acute situations since the numbers are spiking tremendously. I have dozens of patients calling sick. My own partner in crime in Sufi healing activity, my co-vice president, currently has COVID. So it feels like a lot of people all around have COVID. Luckily, again, as I said last week, I haven't seen anybody who's really gotten sick, like severely sick. But nonetheless, I think we really need to cover an acute situation. I'm not going to make predictions as to what's going to happen in the fall. It's not easy to do so. I expect spikes to continue for at least a month or two, maybe towards the end of the holiday season in January, and then hopefully by that point it'll be downturn. But yeah. So with that, maybe while people are sort of starting, drop the questions. Ashley, do you want to?
Yeah, I have some slides on the different vaccines, COVID, RSV, and flu, and what to do in an acute COVID situation as well. So what we can do is start with those, and then there may be some questions that come up as well as you're sort of hearing this information and letting it wash over you.
And Ashley, you're gonna really like what I'm gonna teach today. It's something you're super familiar with, so that's good.
Oh, fun. Alrighty. Here we go. So, of course, everybody knows, Misha just mentioned that the new COVID vaccine is out, and it's probably in a pharmacy near you right now. In addition to that, the CDC put out their recommendation, as they usually do, and they said that they recommend it from everyone 6 months and older. And then they actually took off the market the old bivalent vaccine as well, so everybody can no longer get the older vaccine. They recommend at least 8 weeks between COVID vaccines, like we talked about. Maybe waiting a little longer could be helpful. CIM still recommends about 6 months between infection and vaccine. So if you get a COVID infection, you're wondering, I just had a COVID infection, when should I get the vaccine? Waiting at least 6 months is important. And then in my own perspective, in the way that I sort of treat patients, especially long COVID patients, is looking at the whole picture. So 1, their health risks, and 2, overall, what their previous reaction to the other vaccines were. So that's good to keep in mind if you're somebody who really has had some severe reactions to vaccines in the past. That's going to come into play into your decision making of how long you should wait and whether or not you should get the vaccine at all. So those are some things to think about and maybe talk to your provider about. And then there's also a protocol that CIM uses for vaccine. Dr. Kogan, did you want to talk about the couple of things that you recommend before someone gets a vaccine?
Right. So we talked about this. We like right before you get a vaccine, we like to give 4 things. So there are 3 homeopathics combined together. And then also the something called natural dehist, which is a kind of a histamine lowering supplement that you start 24 hours before to take the day off and then the following day. I think I'm not going to put the actual exact recommendations of protocol. I think it's a bit too individualized, but anybody who's interested can contact us and we can set that up for you. I think many of you probably have that. The homeopathics, if you're interested, they're arnica, Lidum, I believe. Actually, Ashley, continue and I'll put in the chat exact names
Put
of
them in the
homeopathic.
chat. Yeah, great. Okay. So that's about the COVID vaccine, but it's also just cold season in general, right? So we can't just think about COVID right now. We also have to think about flu and we have to think about RSV, which are two also respiratory diseases that cause a lot of debility. So let's talk about that. So I know that you guys have talked about the RSV vaccine a few times in the mindfulness experience. I won't talk about it too much, but I'll just bring it up that, of course, there's two RSV vaccines that are licensed. You only need one single dose. It's recommended for people older than 60 years old, and then some people who are younger who have unique situations, as well as pregnant women. And what they recommend, the CDC, is that you use what they call a shared clinical decision making with your provider. Basically, what that means is it's not just age specific. They're also saying that you should discuss your unique situation with your provider. I think that this should just be overall advice, honestly, with most vaccines, is that it's great to have a conversation with the person who treats you about your unique health situation, because we're all a little bit different. But some risk factors for RSV include anything that, of course, affects your heart or lungs, anything that affects your kidney, your liver, neurologic disorders, diabetes, right? If you're in a nursing home or just happen to be immunocompromised, pregnant in the third trimester. So these are just some things to think about if you fall in that category or questioning whether you fall in that category. RSV does lead to a lot of hospitalizations. And so it is a pretty serious illness as well. So something to kind of think about. Oh, is that all from you? Okay. Yeah, I can share the PowerPoint. That's fine. Okay. And then flu, right? The mighty flu. Flu's been around for a long time, so we kind of all know how this goes. Only thing that's interesting about this year is that they no longer require any special safety protocol for patients who have egg allergies. They used to say that you had to, if you had an egg allergy, you had to get your vaccine while in a medical facility. And now the CDC voted and they dropped that. So now they no longer require people with egg allergies to go through like sort of a special protocol. They could get it at their local pharmacy. What Dr. Kogan and I have been talking about is that we like to separate the COVID vaccine and the flu vaccine by at least 3 to 4 weeks. We really don't prefer that people get these vaccines all together because they tend to have more side effects and the risks are a little higher the more you combine vaccines. So if you're wondering, well, I got to get the COVID and I got to get the flu, what should I do and how should I approach this? The way I would approach it and the way I'm likely going to approach it is that you would get the COVID vaccine first because the numbers are very high right now. And you don't want to run the risk of getting COVID and possibly leading to long COVID, right? Because studies show that the more acute COVID you get, the higher chance of long COVID you can get. So get the COVID vaccine first, wait about 3 to 4 weeks, and then get the flu vaccine as long as you're feeling well. Don't get any vaccine if you're not feeling well. That's also important to keep in mind. Even if you're not feverish, if you're feeling like you have a cold or you haven't quite gotten over an upper respiratory infection, always great to kind of wait that out until you get another vaccine and sort of test your immune system. And then October is the ideal month to get the flu vaccine anyways. So CDC says September or October. I think it's a little bit better to get it a little later in October because the flu season tends to go through about February, sometimes March. It's a little bit later than COVID. And then, okay, let's go to the next slide. So what do you do if you get COVID, right? Everybody's getting COVID right now. So this is like the $1 million question. Not much has changed when you get COVID. One, you want to reach out if you fall in this category of somebody who could benefit from antivirals. Honestly, I think most people could. There's some special circumstances, so I don't want to make a blanket recommendation for everybody. I don't think that that's safe. And most people fall in the category of an antiviral being effective for reducing the risk of long COVID. So there's two antivirals that are on the market for acute COVID, and that's Paxlovid and Molnupiravir. And the only time you really are going to use Molnupiravir is if you have a contraindication or a reason you can't take Paxlovid. So if you take medications that interact with it, or maybe because of kidney function, you can't take Paxlovid, then Molnupiravir might be a good option for you. So it's good for you guys to know, even if you're going to your doctor and asking your doctor what you should do, or you're going to an urgent care and asking them what to do, because you want to be your own advocate when you get sick. Make sure that you take it as soon into your acute illness as possible. I know that the recommendation says that you can take it within the first 5 days. It's most efficacious if you take it as soon as you possibly can. So make sure you test yourself. Also, make sure you repeat test yourself, because what people usually do wrong is they start to get cold-like symptoms, and they test themselves right away. They're like, oh, it can't be COVID. COVID test came back negative. The problem is that these tests aren't as sensitive to pick up the disease as we're thinking that they are. So research has shown that you have to retest yourself in about 48 hours or so. So the way I usually approach it is that if I'm starting to feel sick, I'll test myself. If it's negative, I'm still feeling sick, I'll either wait 2 days or I'll even test myself the next day. Honestly, I've seen patients go from testing themselves in the morning and being negative to testing themselves in the evening and being positive. So that's how fast these tests can change. And it's just because the tests are not sensitive enough to really pick up low levels of viral shedding in the nose. So you really do have to repeat test to make sure. And that's what I see is probably the largest mistake, is that people are kind of going back out into their community or going to work and they're just thinking, oh, I have a cold, it's probably not COVID. I tested myself once and I was fine. And then sort of everybody's getting infected, right? It comes out later. You get an email that says, oh, I guess I did have COVID. Sorry, right? If you even find out at all. Other things that you can do that can be supportive for your acute COVID is one, some people use these nasal sprays. I really like Xlear. It has xylitol in it, which is sort of like an antimicrobial antiviral, just to get rid of the viral shedding in the nose or reduce it a little bit. Electrolytes are really important, because what we see a lot after acute COVID is dysautonomias, an infection of the vagus nerve. And so having a little bit of salt can be really helpful for that, and having volume expansion, increasing your fluids, is helpful for that. So make sure that you have some electrolytes in your home if you come down with an illness, something like Drip Drop or LMNT or Noon. There's a lot of different products out there that can be really helpful. Avoid sugar and processed foods. You may not even want that stuff anyways if you're sick, right? But that's not going to be helpful for making you feel better. Bone broth is really great because it's a great source of protein. From an Eastern medicine perspective, it's a good blood building, I don't want to say medication, or blood building food. And then also it's warm, right? And when we're sick, our stomach wants warm foods. So bone broth is wonderful. Increase the amount of protein that you're getting, because your body's using a lot of protein for all its processes to kind of combat the COVID virus. Take Motrin if you need to. It's an anti-inflammatory. So if you had to pick between Tylenol and Motrin and you're able to take Motrin, take Motrin. You can take baths, keep your feet covered. These are all just sort of general advice for getting sick. Metformin has been shown in studies, if you fall in the overweight or obese category, to reduce the risk of long COVID. And so metformin might be something worth taking during acute COVID if you fall ill. So make sure that you let your provider know. Some supplements, so these are just general recommendations. This is not, of course, going to be for everybody, but these are just some things that we recommend. So some of them are antioxidants like vitamin C. Zinc is great. Vitamin D is great. I mean, vitamin D reduces inflammation. There's also tons of studies that show that people who are deficient in vitamin D also have a higher chance of long COVID. So that's something important to keep in mind, is keeping your vitamin D level up. Most people are deficient in vitamin D, so keep that in mind. If most people are, then likely you fall in that category. And I would say overall, vitamin D is usually safe for everybody. Quercetin decreases the viral replication. really wonderful. You can buy this at, pretty much, well, not at every drugstore, but like a Whole Foods, a Mom's. You can buy it off Amazon, places like that. There's NAC, curcumin. It reduces inflammation again. NAD plus gold. Quicksilver makes a product that's pretty good. So some of these can be helpful for the body's detox system. So you don't have to take all of these, right? And all of these might not be appropriate for your unique situation. So I don't want it to be taken as sort of a blanket recommendation, but these are just a few things that I have in my home that I tend to just kind of keep around in case I get sick. All right, so that was that. So we can take some questions. Also, what wasn't mentioned in these slides, but is very important, is rest, right? Please rest. This is not the time to go for a walk. This is not the time to go for a run or an exercise class. Don't like sweat it out on a Peloton bike. Not a good recommendation. In fact, many of the people I see who have long COVID, their long COVID right before it, when they felt like their symptoms were lingering, they had gone on a run because they thought they had gotten better. They had gone on this walk or they did something very active. And then all of a sudden had all of this fatigue. So I think that we can put too much stress on our body that's already in a stress state. Give yourself the time to rest. Don't push it. Even if it feels like you're starting to get better, take a week after that. Nasal sprays. Is something like silver. Some people use like silver nasal sprays, right? Dr. Kogan, are you familiar with these 2 nasal sprays? I don't use these a lot, but.
Yeah, me neither. They're kind of popular in Europe, but I honestly, I have not seen conclusive data at all. So I'm not exactly sure what to say. Everybody welcome to try, especially if you're traveling. I think that's very useful to have.
Yeah, the flu vaccine for under 60. The flu vaccine is recommended for anybody over the age of 6 months. And if you're a 6-month-old infant, you're going to get 2. First one's always 2. But after that, it's everyone. Everybody gets a flu vaccine every year. And in fact, research shows that the more consecutively that you get them every year, the more protection that you get from the flu vaccine. So it actually does help you to get them every year versus kind of being somebody that sometimes gets it and sometimes doesn't get it. The RSV shot, before COVID shot or after? I would say after. I would get COVID first. The COVID numbers are really high. As soon as that vaccine comes out, if you fall in that criteria where you're 6 months from the last time you were infected or had a vaccine, then I would get it. And then think about RSV after that. It's a scary time. A lot of people are getting sick right now.
I'm still gonna say about RSV the following: if you never had any lung problems, you never had bad flu, you never had bad cold that turned into bronchitis, you had not had pneumonia, it doesn't matter whether you're 65 or 70, I would not take that shot. I just would not. I disagree on certain things with CDC. Yes, we have seen pretty bad season of RSV last year, but all the people, if you carefully look at the studies, the people who got really sick from it were all the people who had predisposition of some sort. They had pre-existing lung problems, they had frequent episodes of bronchitis, they had immune suppressive disorder like cancer or something. It's a brand new vaccine. I don't know what will happen with it. There's a wisdom in waiting and seeing what's going on rather than jumping at some new treatments that, frankly, chances of you dying from RSV is exceedingly low. Chances of getting severe illness are much higher. The point is that even with that, it's still not going to be an overwhelming illness. You're going to have a significant bronchitis in a month or 2, you'll clear it. The question here is, there's all these vaccines that we're told to get. We had a grand round presentation yesterday. And listen to this. The guy is the head of a lupus foundation at one of the largest healthcare systems in the world. And he said, oh yeah, we've seen COVID vaccine cause lupus all the time in our clinic, but I still recommend it. I'm like, excuse me, what did you just said to the public? He's like, yeah, very high frequency of lupus after vaccines, after COVID specifically. We're seeing hundreds of patients in the clinic. That was his words. And, you know, so you hear this and you're like, wait a second, that is not what people tell you. So everybody's aware of this, that we see a dramatic amount of autoimmunity after specifically the newer vaccines. So you have to balance this. Nobody's arguing you need them, but, you know, my whole point here is, you know, just weigh pros and cons carefully, think about everything. Don't go and, I mean, I have few patients in my practice who've been getting now 8th or 9th booster. You know, I'm not going to judge them, but in my opinion, this would be a tremendous success that I don't really think is going to be in their benefit of any kind. So just putting it out there. Right. So correct. Elizabeth is 100% right about this question about blood thinners. We were just talking about that yesterday in our group. So yeah, if you're on a blood thinner, you have to talk to your physician if you need to take Paxlovid. It's more important actually with Coumadin than with Eliquis, but still, please, yes. So you will have to hold anticoagulation potentially for the duration of Paxlovid. It may or may not be a big problem. If you're getting blood thinner for atrial fibrillation, it's probably okay. But if you're getting it from a history of a clot, you may not be able to stop it. So you'll have to really talk to prescribing physician about this and make sure that you get the right medication. And it may not be Paxlovid. This is exactly the situation that Ashley was describing.
Yeah.
Do you want to address the other question?
Should we be concerned about the flu vaccine lowering our immunity? No.
This question comes up all the time. Yeah, and the answer is simply no.
Yeah, I would just say no.
I mean, I think I know what Al is pointing out. I think basically saying, look, the natural immunity against certain illnesses potentially better and stronger. I kind of agree with that. The problem here is the flu is mutating way faster than COVID. And so reality is we only have a T-cell protection against flu. We talked about this, right? So there is an antibody protection, and then there's a T-cell protection. The antibody protection, if the body hasn't seen the exact copy of the virus, not going to get generated. The thing is, though, with a T-cell protection against flu, there is a continuous partial protection. The vaccines have nothing to do with T regulation whatsoever, not even remotely. They're not going to change that left, up, down, whatever. They're only going to change really in truth well, they will change, vaccines will change T response, but delayed. But they will change primarily the B response. And so if you did not get that shot and you don't have the antibodies floating around to respond to the virus, you know, this is going to be one response. If you did get that shot, it's not like there's going to be all these antibodies and they're going to miss hitting something else if you get another kind of infection. It's just not what happens. But the problem is, forget the flu vaccine for a while. I think I'm particularly talking about the newer technology of vaccine. There is a concern that the newer technology seems to upregulate the immune system a bit stronger than the old vaccines in a less predictable way. And so this autoimmune conditions that are on a rise after these vaccines appear to be related to that. So that's not a lowering of immunity, it's actually upping of immunity. The immune system is in a very careful check and balance. I think it's very easy to mess that up. And so I think we're just basically voicing concern. I think we're basically saying, look, you probably don't want to just get all these vaccines in some kind of a random, let's get them all together. Who cares? That's what CDC said, right? They can't be wrong. Like, I would be careful with that, especially if you're somebody who's very sensitive to something. Like, I'm looking at the screen, I know some of you, and some of you are very sensitive, and I would be like, oh my God, I would really think about 10 times. Like, I know one of you smiling right now, I'm looking at you, you know who I'm talking about. And, you know, like, I know, but probably shouldn't get any. because the risk of a hyperreaction, potentially even anaphylaxis, is there. So, so you really need to know your personal sensitivity, your personal allergenicity, or the capacity to generate allergic reaction or upregulation of immune system to know whether you're going to accept the vaccine or not. It's not black and white. There's all kinds of shades of gray here. I wish it would be black and white. It would be a lot easier, but it's not. So yeah, but I was stunned yesterday at that grand rounds with this pretty esteemed speaker being so upfront about the fact that they're seeing a lot of autoimmune diseases, particularly lupus, after vaccines. I was just stunned. I was like, wow. And I hear from other colleagues who are not in a very traditional establishment. They're definitely not integrative medicine providers saying the same thing. Everybody's seeing a spike in autoimmune diseases. What will happen decades from now, we'll see. I have one theory here, which I'm going to share. I kind of really wondering, and unfortunately, Dr. Frame is not in today, right? Janet. Otherwise, I would have asked her. I'm kind of wonder what could be the possible interplay between disturbed gut microbiome, autoimmunity, and vaccines. That's a pretty interesting question. Could the people who have hyperreactivity to certain things have that because their gut microbiome is shifted in a way that they create their response to any stimuli is hyperstimulated, because some of them healthy bacteria is not there to suppress the inflammatory response on a gut level. There's been some work done. I'm not an expert in this, but I'm just wondering if that's part of the issue. So
I would think so, yeah.
Mm-hmm.
I think they want me to put my last slide up. I got a private message for a minute, so I can do that. That's fine.
And Ashley, could you just send me those pages?
Yeah, I will. Yeah.
And then I'll share them with the group.
Yeah.
Thanks.
It's part of a bigger PowerPoint, so I'll just send you these 3. Also, always remember you can take a little picture with your phone of the screen too, if that's easier. Don't hurt your hands writing all this stuff down. Use technology to your benefit.
And some of these products can be combined. So like, for example, the DHIS that I put, it's a combination of quercetin, N-acetylcysteine, and some vitamin C. There's this also product called BCQ, which is combination of quercetin, bromelain, turmeric. So you can also, like, if you don't want to get all of them, you can sort of combine them in a certain way. The exact amounts are kind of, like, should you really get 1,200 milligrams of NAC, or would it be okay to get 1,800 or 1,000? We can't tell you yay or nay. I mean, none of this is hardcore evidence that I can say, okay, you have to take 1,000 because the study says so. A lot of this is based on our empiric kind of evidence in the clinic. We know these are the typical doses we use. And
yeah, don't put so much stress and pressure on yourself anyways. Just do the best that you can do. You're going to be sick. That's why I say it's good to plan ahead and have some of these things in your house, because otherwise you're going to be sick and you're going to be thinking to yourself, how am I going to get all these things? And you're waiting for them.
There's also a component of placebo. Don't ever discredit that. I mean, it's a powerful thing. Placebo is a good thing. Okay. So I joked about this Wednesday or yesterday. I forgot when we talked about that John Hopkins had this drug called Overcome, right? So you guys all heard about this, right? Until mid-70s, when, of course, the ethics removed it from formulary because it was just placebo spelled backward. It was a sugar pill that the John Hopkins was prescribing to like half of all their patients in the hospital. And it was completely normal. They were like, yeah, we know placebo works. Let's give it to all of our patients. They'll get better, right? Yes, they were getting better. And then, of course, ethics said, are you crazy? This is like a lawsuit waiting to happen. So they stopped it. But principle is you can take something that may have theoretic benefit, like all of these things listed here, even though we may not have a concrete randomized data, you're not going to get harmed by any of this for a short period of time. So
yeah. One of the questions was asked about how long. So these vaccines are actually, or sorry, these supplements are actually for when you get acute COVID. They're not after a vaccine. Are you talking about the ones that Dr. Kogan had listed, Beatrice? From the above.
I think I answered that, because those
Did you answer that somewhere?
yeah, because the DHIST, if you take around the time of vaccine, it's just for a day before and day after. So it's just
Yeah.
a total of 3-day course. So it's short.
You're not taking them for a long time. No. Vitamin D is Pat's.
No, not at all,
No.
Elizabeth, because you, in order for you to get to vitamin D toxicity, taking 50,000 or whatever, you'll need to take it for many months. So 5 days, 10 days is not going to do anything. I don't give 50,000 per day. I kind of go anywhere between 10 to 20. Probably doesn't really matter. I mean, 50,000 for 10 days, it's only 50, 100,000. It's not that much actually in sort of grand scheme of things. The skin has capacity of generating 20,000 easily within few hours. Most of us don't get that, but you know.
Yeah, the problem is most of where we live, we're not getting really enough sun exposure to get a ton of vitamin D.
And you don't want to get burned, so it's not a, you know, it's a
Yeah, absolutely. That's the other piece too. Don't get skin cancer just to get your vitamin D. Then you get another problem, right?
Somebody is asking about the chart for vaccines. I'm not sure I can quickly find it.
Are they talking about the okay, I'm going to stop sharing this slide for a second. Are you talking about the CDC
Yeah,
chart?
there's a, yeah, you can go on the CDC website and just find it there. It's also linked, supposed to be in one of the prior presentations. Right now I need to start getting ready for the practice, so I'm going to
I'll see if I can find it, and then I will post it, the link in the chat for everybody.
I'll take a minute break. Gotta run to the bathroom, and then we'll move to the some of the practices today. Ashley and B, you're not going to learn anything new, but that's okay. All right, I'll be right back.
Okay, yeah, I just put the CDC. If you go to that link, you'll be able to find the ones for children, the ones for adult, the ones for everybody. The COVID-19 vaccine schedule, it's all there. So I hope that helps.
Just a reminder, everyone, we will not be having a mindfulness experience next week because we will be doing our GW Medicinal Fungi Conference from 9 in the morning to 4. So we will not be having a mindfulness experience, and hopefully you plan on joining us for the Fungi Conference.
Okay, everybody, so I'm gonna put something in the chat so you can take a look at this link. So this is a overview article of using Qigong medically as a therapy for acute COVID. There's 12 large randomized controlled trials showing not only better COVID outcomes, but significantly shorter recovery as a treatment for acute COVID. So they looked at the variety. So Qigong, of course, Ashley talked about this. So we have actually 2 teachers of Qigong. One of you is right there, Dr. B. Lipson. She's been teaching Tai Chi and Qigong for many decades at GW. And of course, Ashley went through Chinese medicine school, where they actually, every TCM practitioner learns this as part of their training. It's a standard because they have to then demonstrate it to their patients as part of the standard recommendation for a variety of medical problems. So the reason I chose Qigong for today is for two things. So one, I actually tried to do a little bit of research as to what are the best breathing and mindfulness practices that can be utilized in the moment of getting COVID, in the moment of getting an acute respiratory illness. And Qigong turned out to have the best evidence out of everything I was able to find. And then on top of that, the technique that I'm aware of, and I've been doing it for a decade plus myself, which is 8 brocades. If either of you, Ashley or B, want to tell us the Chinese name, be my guest, but I never remember that. So that's what we'll do. We won't do the full sequence because I actually think that only the first, all right, only the first 4 are the ones that are more important for the lungs and for any kind of complications related to respiratory system. But what I will do, I have recorded a full 8 brocades and put it on my YouTube some months ago. So I will give you the link to that. So by all means, feel free to take a look. To do the whole 8 brocades takes about, I would say, 20 minutes. If you're not in a rush, you can probably do it a little bit faster. Not sure I would actually recommend that, but nonetheless, I think that would be reasonable timing to do it a little bit faster if you have to. So just give me 1 second. I will put the link up. And then we're gonna do practice. For some reason, it is not coming up quickly. So, okay, well, I will put that in later because for whatever reason, I can't find it at the, oh, there it is. Okay. Okay, so you can take a look at that. So make sure if you're going to follow me, make sure you get space enough for you to be able to stand up and have a free space to move your hands in a way that nothing is obstructed. Can you hear me well from where I am? I can do something else. I can put earpiece that may improve the sound. Can somebody show me a thumbs up if you hear it? Okay, great. So I'm actually gonna change my position a little because I don't want to have sun in my face. Oh, well, actually, I'll have to because otherwise you won't be able to see anything. So, okay, so find yourself comfortable. We're starting with a standing position. One of the simple principles in Qigong, you want to make sure that your body's limb relaxed. Unlock your knees, very important principle. So you're not standing, the knees are a little bent, just a little bit. That's first. Then you also want to make sure that you talk just a little bit, like there's this movement where you tilting pelvis like this a little forward while the knees stay bent. So this is the beginning position. When you're starting, we first just inhale slowly up, reaching all the way, interlocking our fingers like this, and then exhaling slowly, bringing the fingers almost touching the crown, and then reverting up, inhaling and stretching. Oh, sun is so nice. And then exhaling, lowering the hands. Each movement is done 8 times, which is what we're gonna do. And exhale. And again, inhale up. And exhale down. 4, 5. And exhale down. 2 more. Exhale. And the last time. So lower your hands, shake them a little bit. Make sure you don't feel any part of the hands, shoulders feeling tired or stagnant. You want to make sure you take few seconds between each movement. In fact, let's actually pause for a second. I just realized I feel a little, I guess, tense, maybe just because I was sitting all day. So let's do a little bit of shaking first. So that's also very good for all kinds of issues. But most importantly, I think shaking really allows us to drop all the stress that's physically accumulating inside the tissues of the body. It's a very good stress unloading method. Okay. So the next one, we start with the hands in, not quite touching, but they're at the level of the heart. The right hand's going to go up like this, and it's going to stay turned towards the other side. And the left is going to go down and facing forward like this. When you reach the top, you go into slightly bend forward like this. And then when you're reaching the comfortable point, don't overstretch. Then you slowly come back and you exhale and you bring the hands equal. And then you're doing the other side. So inhale up, stretch, and then exhale back and relax. So let's do this full sequence 8 times. When you're reaching to the side and you're finishing the inhale, try to take the breath a little deeper. The point is to really open up the lungs and stretch. So this is a very important practice for the acute infection in the lungs, because it allows you to expand the lungs as much as possible. And then we'll talk about another technique after we're done with this in terms of helping the lungs to expand. So let's do the other side. Inhale. Stretch. And exhale. Sorry if you're hearing a lot of noise. It's very windy, but I hope my computer muffles it a little bit. And the pace of the movement should really follow your breath, not mine. So if you're doing it and you're feeling like you want to slow it down or speed up, that's by all means, because the pace of the practice should follow your personal slow breath, possibly slowing even more, and really flowing with how you're breathing naturally. If you feel a cough, like you're feeling you need to cough, do not try to suppress it. Stop and cough. It's a very good thing, because cough reflex is what's clearing the lungs from any junk. And you may actually feel, if you feel any congestion when you start doing this part, you actually may feel a lot more cough. It's not a bad thing. It's actually good. I lost count, apologies. So let's do this one, the other side, and then we'll move to the next. Okay, great. Come back. You may want to, again, rest your shoulders, roll your shoulders a little bit just to make sure you're not keeping any tension. Okay, so we'll do 2 more. So the next one, well, actually, we're concentrating on the lungs. When you, if you're gonna use the link in the chat, you can see all of them. We're not gonna do all of them. I'm just gonna do the ones that are known to be more specifically designed for the lungs. Okay, so the next one, if you have a hard time keeping the balance, you have 2 options. You can sit in a chair, and you can do it like this. You, instead of raising yourself up on the tiptoes like this, you can actually sit, and then when you're doing the stretching up like this, right, you can also point your knees upwards and kind of move on the toes. And then when you bend forward, so you inhaling, you can do it that way. Or if you're okay standing, your second option, I'm going to back up a little more. so you can see me fully. So you can inhale. It goes like this. Inhale, lift yourself up, and then gradually, slowly exhale, lower your hands, and then begin, like maybe spend a second here relaxing. And then again, inhale, slowly come up, reach all the way up, and then reach upwards, stretching your as much as possible lungs, both ribs, and then exhale again down and continue. If you can't get up on your toes, don't worry, just inhale up. Don't go up on the toes, just stand like this for a second or two, and then exhale and go down. Inhale up, reach up, and then exhale. Begin slowly. Follow your breath. Notice that I'm bending my knees quite a lot when I go down. That's one way of doing it. If you're like me, inflexible. Important point here is to fully relax the spine, let it kind of, and the head, let it kind of just hang down. And then when you come up, again, come up. And let's finish this one. Shake yourself up a little bit again. And the last one in this series of 4 is a bit more complicated. Again, you have some options. You can sit on a chair with a, like literally just like this. So you can just put your feet wide and sit. And this would be one way of doing it. Your other way, if you're willing to stand, but you're having a hard time holding wide stance, just stand a little wider and bend knees just a little bit. Don't go all the way down and don't make yourself too wide. So otherwise, find a comfortable position like this. You put both hands not over the hips. They're a little bit lower. So right here, right under the hips, on the legs. So then we inhale, turn head to the right, come back, and now inhale all the way and do this full circle, and then exhale going down, and then come back up. So this is really good for the chest, for the breath, and also for the abdominal cavity. And then left, inhale, exhale, inhale, inhale, inhale. When you pass halfway, then you start exhaling. And then you come back, and we continue. Inhale, exhale, inhale, and exhale. Keep it slow, steady. Let's do one more cycle. After this one, this is still the second portion of the one before last. Now we'll do the last. Inhale, back. Other side. Okay. Let's come back. I know we still have a couple of minutes, and I want us to do a second part of this, which is not really a Qigong, but rather an abdominal breath, which is also quite well documented. So in the same article I posted in the chat, you will see, you will see that there is discussion about abdominal breath. So the way to sense whether you can do effective abdominal breathing, the best thing, my suggestion, is to put a hand on the belly. You can put two hands like this, one above the other. Maybe it's just easier to put one hand. And then when you start inhaling into the belly, so when you inhale, the belly is going to rise. And then when you exhale, it just release. So what this does, it moves the diaphragm, and it moves it a lot more than the regular breath. When you breathe through the lungs, through the regular breath like this, right, you're moving the chest wall, but the diaphragm goes down a little bit less. When you're doing the belly breath, you maximally engaging diaphragm. This is why it's actually important to practice abdominal breath a lot, and especially during acute COVID, if you do get it, use this technique. Just move the diaphragm so the diaphragm doesn't get stuck. It's very common during respiratory infection for diaphragm to sort of like one part of diaphragm just stop moving really well, because either there is a little bit of a pus sitting at the bottom of the lung, part of the lung can collapse, it's called atelectasis. There could also be some minor adhesions that can be occurring with any kind of inflammatory process. So this is very good to kind of mobilize everything, okay? So again, put your hand on the belly, relax it, inhale slowly and let the belly naturally rise. And then exhale. When you're exhaling, make the exhalation a little deeper, almost like feels like hand is falling inside the belly. That's what you kind of want. Try to make the breath very slow. And when you exhale, exhaling extra is kind of sinking the belly inside, trying to touch the spine with exhale like this, will allow you to take a next breath deeper. If you're having a hard time feeling the movement here, don't give up. It takes a lot of practice to do the abdominal breath. So if you don't do this on a regular basis, just good to practice. So during this season, my recommendation is that you do abdominal breath for 5 minutes a day. I personally like to do it in the morning, right after I wake up, and I combine it with some of my other practices. So I would do it actually while I'm laying down. It really doesn't matter. This is also great practice to do during driving. So obviously, hands on the wheel, right? Hands not on the belly when you're driving. But I did say that. Nobody can fault me for that. So keep your hands on the wheel and just concentrate on belly rising on each inhale and then kind of falling back down when you exhale. We're almost at the hour. I know there were lots of questions directly to me. I apologize if there's some things I didn't answer. As you can see, today is a little busier than usual. I'm going to try to answer the last couple of questions directly to people who asked them. All right. We'll see everybody a week from tomorrow. Remember, just reminding what Janet said, right? And if you have not signed up for the Fungi conference, I highly recommend Andrew Weil, Paul Stamets, head of John Hopkins Psychedelic Institute. Everybody's going to be there. So if you're not there, you're missing out. Am I good as a salesperson? Not really.
Good job, Misha.
I hate that stuff, but no, but seriously, we put a lot of effort in, well, Janet really put a lot of effort into putting all this together, and I think it's going to be a marvelous conference. So, and you know, I'm presenting, Dr. Sarah from our clinic also presenting on use of medicinal mushrooms for cancer. So I hope you guys will join. And last but not least, what do we have in 2 weeks, Janet? Is it easy for you to pull up the schedule?
In 2 weeks, let me pull up my sheet.
That would be the October, right? Already or not? Not yet?
Yes,
No, that'll be September 29.
I think Dr. Frame is scheduled to do the talk. Yes, she is. Dr. Frame is scheduled to do the talk. So y'all know it's going to be nutrition related. And still working on getting a mind-body practitioner for that spot. But we'll have that done. And so please come back after the conference.
Okay, everybody, we'll see you next week, hopefully. Otherwise, we'll see you in a couple of weeks. Enjoy this absolutely marvelous weather. Be outside. Highly recommended. And yes, there are 3 dogs, if you were wondering. The third one is we have a person who lives in a basement, and that's his dog. So, yeah.
All right. Ciao, ciao, everyone.
Bye.
Thank you. Thank you.